I'm John Moore. I'm a staff photographer for Getty Images. I was in Liberia for 12 days covering the Ebola epidemic. The night I arrived, the authorities, the health ministry, opened an isolation ward in the West Point slum of Monrovia. It's a township of 75,000 people, very congested, and on a peninsula, and there's only one way in and one way out. Now, this isolation center was a closed primary school, which had originally been made with USAID funding years ago. It had been closed because of the epidemic. There was no electricity. The first day I was there were healthy people and people with symptoms all in the same room. Some were deathly ill, others were not. At one point, a man got up and tried to walk to another room, and he stumbled and fell back on his head, unconscious. His wife stood over him grieving as the blue light filtered in through the windows. It was a haunting scene for me. In the next room over, there was a group of children with an aunt, and they were in various degrees of sickness. One of the boys was lying on a mattress face down. I never saw him move. Many people believed that they did not have Ebola in West Point. The local community was very upset that that center had been placed in their neighborhood. They staged a demonstration. A group from the Ministry of Health, a burial team, had come in to collect 4 bodies in the neighborhood, and they drove out the body teams with a hail of rocks, and afterwards the mob marched on the isolation ward and pushed through the gates and overran it. They pulled out the patients, many of whom had suspected Ebola, telling the patients that they didn't have Ebola after all, and that there was no Ebola in West Point. And one of the boys was named Sa Exco. I found him several days later in an alleyway in West Point. People were afraid to touch him. There was some compassion, but there was also fear. He was in terrible shape. You could tell he was dehydrated. He had not received care. And people did give him clothing and tried to keep him warm, and later brought him medicine. He was taken to a hospital later that evening and passed away the next day. For family members of Ebola victims, it's very difficult. Number one, if their family member dies while they're there, they have this incredible danger of infection. People are starting to understand that they can't touch their relatives, they can't comfort them in the way that you want to comfort a sick relative. And when someone dies of Ebola, they're taken to a crematorium, and people are not allowed to attend the burial service. There is no burial service for Ebola victims. And when people are taken away sick in an ambulance to an isolation ward, family members know that that might be the last time they ever see them.